Hi, my name is Leslie Polo. My topic is Polyhydramnios, Transient Antenatal Bartter syndrome, and MAGED2 mutation. Definition: Polyhydramnios is the excessive accumulation of amniotic fluid, which is the fluid that surrounds the baby in the uterus during pregnancy. It is caused by an imbalance between either production and removal absorption rate. For instance, in fetus with esophageal atresia. Application in medicine. Because polyhydramnios occurs exclusively in the pregnancy with male offspring, we filter in the result obtained by whole exome sequence analysis of DNA from Bartter and his mother for rare, shared X chromosomal variants. Polyhydramnios was recognized early during pregnancy at 20 week gestation, or the infants were born preterm. Sequence was the extremal preterm. The onset of polyhydramnios and labor occurred several weeks early that unknown type of Bartter syndrome. Two fetuses died in utero without recognizable cause autopsy, and one infant died for extreme prematurity.
DNA rarely makes mistakes, but it can happen. A point mutation changes a single base. This can change the whole amino acid, or depending on its position, could go unnoticed. Other mutations can be more damaging. A deletion removes a base, but also causes a frame shift, which changes every amino acid after the mutation. Originally, the codons would be formed in this pattern. But after the deletion, the amino acid sequence will change because the bases shift by 1. The resulting protein will likely be non-functional. An insertion adds a base, but also causes a frame shift, which changes every amino acid after the mutation. Originally, the codons would be formed in this pattern. But after the insertion, the amino acid sequence will change because the bases shift by 1. Again, the resulting protein will likely be non-functional. Lastly, an inversion will invert a segment of DNA end to end. Watch this section closely. Each base has been moved around. Again, these mutations have the potential to be harmful, but not all mutations have an effect on protein. Remember, during translation, a start codon must first be read to begin coding the protein. If the mutation happens before or after the protein coding sequence, there will be no effect on the protein. Mutations must occur in the coding section of DNA to affect protein synthesis. Otherwise, nothing happens. Thanks for watching this episode of Teacher's Pet. Don't forget to like and subscribe and follow me on Twitter at SciencePet.
Pro. The polyhydramnios caused by the mutation tend to be mild, so it may go away its own. The Antenatal Bartter syndrome is transient, meaning in temporary. The fact that it happens only in male baby can be seen as pro. Con. They're using treatments that fix hen mutation. Gas can complicate, leading to the death of the fetus. That fact it happens only in male babies can be seen as con. Is applied in Ecuador. In Ecuador, polyhydramnios is found in control than to pregnant women. And the MAGED2 mutation can be cause of some of the cause. There is information about Bartter syndrome in Ecuador is may be given to its rarity. The care and treatment forecast at present is made not the best.
Antenatal care is the care of pregnant women, and this is provided by trained healthcare professionals. And in Kuwait, this is done by the doctors and usually in hospital or in clinic settings. Antenatal care has to be individualized according to the risk factors which are present in a woman, so it's different for different women. These risk factors can be as a result of the patient herself, which she may have some medical conditions like high blood pressure, diabetes, asthma, heart problems, or just vitamin deficiencies. Or somebody may have infections like HIV or hepatitis. Some women, they may just be high risk because of obesity, that's overweight. And some women are high risk because they smoke. The others mainly as a result of their mental health problems such as depression. Sometimes these risk factors can happen as a result of particular pregnancy itself. For instance, she's got twins. For instance, this baby is growing too big. We call it large for gestational age. Or the baby that's growing small, which is small for gestational age. And this can also happen as a result of, for instance, the fluid around the baby is too much or fluid around the baby is less, or when her membranes rupture before time, and as a result of diabetes developing in pregnancy, or preeclampsia or antepartum hemorrhage. These risk factors can also happen as a result of previous pregnancy history. Previous pregnancy problems can also put a woman in the high risk category. Family history of congenital abnormalities. So this is another one. A family history of genetic disorders. So they can all make a woman high risk. High risk or low risk, we do not know sometimes until the pregnancy is over. So that's why we have to follow up every woman.
Conclusion. This recent information about the effects of the mutation of the MAGED2 hand is important to consider so doctor can give a good and complete diagnostic and also giving the best care during the pregnancy. As it is hand mutation, there isn't a treatment for the MAGED2, but one can be treatment in the Polyhydramnios, and the effect production is the Bartter syndrome. Also, the diseases are normal.